Welcome to the wide world of the urinary system. Ooh, sorry about that. The urinary system is pretty straightforward. There's really not much to it, and the whole entire idea of the urinary system is to eliminate waste and maintain water balance. Urinary systems actually work differently in humans compared to if you were in the desert, living in the desert, where you want to essentially try to maintain as much water as you possibly can, or if you were living in fresh water, where you want to maintain as much salt as you can, or in salt water, where you want to essentially keep salt and water out of you. So, weirdly enough, the urinary system is going to be vastly different depending on what type of creature you actually are, and some creatures it's going to change throughout your lifetime. Good times. The urinary system is essentially going to be two kidneys, bloop, attached to two ureters, bloop, to one bladder, whoop, to a urethra, whoop, and out. Generally, the kidneys are going to be in the back of the back. Yeah, that works. About one hand width or so above your coxal bone. So above your coxa, it's going to be about one hand width, like that-ish, from your coxa to your kidneys. Then your ureters go down into your bladder. Bladder is going to be more in the middle. And then you have urethra, depending on who you are. And by that, I mean what type of genitalia you have present. You either have a long urethra, if you happen to have a penis, or you have a very short urethra, if you happen to not have a penis. So if you have a vulva, which essentially makes it so that there are some things that are going to be more common within the uterine population compared to the penile population. So if you, and by that I mean urinary tract infections and bladder infections, because of the length of the urethra being shorter, is going to be much more common within uterine-bearing populations rather than not. And I mean that also with all people who happen to have short urethras. Not necessarily everybody with a uterus has a short urethra. Also, not everybody without a uterus has a long urethra. Depends on whether that urethra is long or short. The longer it is, the less of a chance that you end up getting bladder infections and other things like that. But that's also a completely different conversation. The urinary system is also called the excretory system, or the genito-urinary system, or the urogenital system. It's because you have the combination of both genitalia and urine producing at the same time. Essentially, the urinary system, or the excretory system in this case, is in the process of eliminating urine. So producing, storing, and eliminating urine. There's a variety of different functions of the urinary system. A lot of this has to do with the kidneys. The kidneys themselves have a weird type of way of doing things. They take a lot of stuff out of the blood. Essentially they shove everything out of the blood. They bring back the stuff that they need to, and then they once again shove out the urine, and then you pee it out. This is essentially where they live. So here are the kidneys. They are highly vascularized in that they have a large amount of blood that goes through them. And then the ureters go through to the bladder and then out through the urethra. The kidneys themselves have a variety of different places to them, and we'll talk about that in a couple of slides, but they produce urine, control bodily fluids, and help regulate the body. So they deal a lot with water balance. Ureters transport urine from the kidneys to the bladder. Bladder serves as a reservoir and can change in size. The urethra goes from the bladder out. Females have a separate urethra compared to vaginal canal. The male semen also travels through the urethra as well. This is an idea of what a nephron looks like. Within the kidneys, there are a hell of a lot of nephrons. And a nephron essentially starts out with the glomerular capsule. Glomerular. This is called the glomerulus. glomerulus, glomerulus. You might see the glomerular capsule being referred to as Bowman's capsule, but there is actually no direct link between the Bowman's capsule and the glomerulus. The glomerular capsule and the glomerulus. The glomerulus is a ball of artery or arterial that makes it so that there's a large amount of contact area or close space between the capsule and the glomerulus itself. Then there is the proximal convoluted tubule, which is close. The descending nephron loop, or the loop of Henle, the ascending nephron loop, the distal convoluted tubule, and then the collecting duct. There are different portions of the kidney. There are the portions that are called the pyramid, the medulla or medulla, the hilum. The renal cortex is on the outside. The renal pelvis is here. And these individual little things are called calyx or calyces. You have your kidney that goes into the bladder through the ureter. This is showing a cross-section of a male through the pelvis. A couple things that you should also note within males, there is going to be the prostate that goes around or surrounds the base of the bladder. It can grow in size as males age, which can cause difficulties in urination because of the limited amount of space that actually exists within this area. The prostate also provides essentially some lubrication for seminal or semen production. In females, you can see that the urethra is much shorter than males. So there it is in females. Here it is in males. So there's a wide variety of difference in size. You can also see here is the uterus, which is one of the major reasons why if you happen to have if you are with child or if you are gestating a child, then that makes it oftentimes, depending on how you're actually holding the baby, and by that I mean in your uterus, where it hangs out, whether it's high or low, it can cause a large amount of urinary issues. You can't fill up your bladder as much if your whole abdominal canal is filled up with baby. This is a different type of view of the nephron, so you can see it once again, and it also goes through glomerular filtration, which goes from the glomerulus out into the nephron itself. The tubular reabsorption, things go back into the blood, and then tubular secretion, things come from the blood into the tubule. So that is some of the things that you need to know about. And then reabsorption is always going back into the blood. Secretion is going from the blood into the tubule. So proximal convoluted tubule, distal convoluted tubule, collecting duct. That's pretty much it. If you don't get this, that's okay. You don't really need to. You just need to know the words. I'm just trying to provide a little bit of context to some of those words because some of them are really super awkward. Either way. Once again, if you have any types of questions or anything else like that, please stop by and ask. See you later.